All right. So hello, everyone. Welcome to our webinar hosted by the American Public Human Services Association, or APHSA, and one of our strategic industry partners, Northwoods. Today's webinar topic is Going Beyond Self-Care, Refocusing on Worker Well-Being to Combat Turnover. Next slide. So I am Adrian Saldana, an organizational effectiveness consultant at APHSA. I would like just a minute to share with everyone an overview of APHSA and the work we do for our members. APHSA represents state and local health and human services agencies from across the country. Next slide. We aim to deliver to our members through three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and organizational effectiveness consulting, and connecting members across a wide circle of stakeholders and partners in the health and human services sector. Next slide. I invite you to attend one of our three upcoming in-person national conferences this month. Our attorneys APHSA conference will be held October 9th through 12th in Columbus, Ohio. And our Information Technology Solutions Management, or ISM conference, will be held October 23rd through 25th in National Harbor, Maryland. Registration is open for these two conferences. Unfortunately, registration has closed for our Staff Development and Training NSDTA conference in Spokane, Washington from October 16th to 19th. Though you can still submit your name to our registration waitlist. During this webinar, we invite you to put your questions for our presenters in the Q&A panel. Because we are expecting quite a large group of attendees, the chat feature has been disabled. If possible, we will try to answer questions during their presentations, but there will also be time left at the end for questions. Now it's my pleasure to introduce our moderator for the panel discussion, Laura Hatfield, Director of Market Advocacy at Northwoods.
Hi, everyone. I'm Laura Hatfield. Thank you, Adrian, for that intro. I am the Director of Advocacy at Northwoods. I am a social worker who works for a technology company, not the path that I could have guessed for myself, but I am a former ongoing child welfare worker out of Wisconsin. And just a quick thing about Northwoods, we build solutions for human services agencies. And we've partnered with local and state agencies over the last 20 years across the entire country. And our mission is to ease the burdens on caseworkers, supervisors, all agency staff, so that they can in turn deliver on their missions to provide better and more equitable services for the populations that they serve. And we're always looking to amplify best practices and good ideas that are happening out there in the field, which brings us to the topic of this webinar. I first heard about the concepts of psychological safety and safety culture during a child welfare dialogue put on by the University of Wisconsin Title IV program, where I heard Dr. Lindsay first speak. And every time she said something new in that presentation, I was like, yes, 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 that's it. Because I've long been thinking and writing about how self-care strategies place the onus of that care on the very people who are already under so much pressure and stress. And now more than ever, with the workforce shortages across the programs that we all serve, reaching levels we've not seen in some time, and I'm sure many of you on this call can attest to that, we all must shift to an organizational responsibility for the well-being and care of our workforce. So I'm excited to dive in today with this panel on what that means and also what that looks like with an example out of Ohio on a local and a statewide level. And I hope that you walk away from this hour we spend together with some tools and ideas and really tangible things for how you might be able to implement this in your own agencies back home. And we do have people from across the country, I think almost every state here today. So I'm really excited to talk with you all. So that's a little bit about me and Northwoods, and we're going to introduce our panel here. And I'm going to let them do that honor themselves. So Tiffany, can you share a little bit about yourself, please?
Hi, sure. I'm Tiffany Lindsay. I am a mental health counselor and assistant professor at the University of Kentucky's Center for Innovation and Population Health. I have a history working with vulnerable populations. Most recently, before doing the work that I do today, I was one of the quality improvement directors at Tennessee's Department of Children's Services.
Great. And Chip, please, if you could go next.
Sure. I'm Chip Spinning, Executive Director of Franklin County Children's Services. We're in Columbus, Ohio, a large child welfare agency, and I've been a director in child welfare since 2000.
Thank you. And Mike, if you wouldn't mind.
Hi, everyone. My name is Mike Kenny. I am the Director of Strategic Initiatives at PCSAO, and we'll get into what that means in a moment. But just want to share briefly that everything in my work is driven by the belief that we can keep kids connected to their culture, their community, and their kin. And in order to do that, we have to have a healthy and supported workforce. And so that's my passion for this effort.
Thank you. And thank you for grounding us in that. So let's get started here. Dr. Lindsay, if you wouldn't mind, I'm going to start with you. And I'm interested to start with the fundamentals. For those on the call who may not know what psychological safety even means in the context of the workplace, I'm curious if you can tell me a little bit more about psychological safety and how you first got involved in this work.
Sure, absolutely. Yeah, I think psychological safety is maybe becoming a bit of a buzzword right now, which is a really good thing. And also it means that, suddenly it could start to mean lots of things and not kind of this really concrete place that I'd like to start and how I think of it. Certainly how we understand psychological safety and its early research. Also, all the really current thought. Amy Edmondson from Harvard, if you're not familiar with her work, she did an excellent TED Talk on psychological safety. She's done a lot of research. She's written some books. She's certainly my resource that I go to keep innovating and think differently about psychological safety. So definitely would recommend that resource to you. But sure. So to your question, Laura, what is psychological safety? It's a shared belief that comes from shared experiences. So I think that's important to say because we can kind of conflate psychological safety with trust. And trust is really important, but trust can have a lot to do with my confidence, with my experience. I alone can't decide if the team I operate in or if the agency that I direct is experiencing psychological safety. I only know by asking, where it may be present or where it may be absent. It's something that we have to agree upon and experience together. So a little different from trust. It's also a place where mistakes are treated as opportunities to learn, so not a time to blame and punish. So it's really about a restorative approach to learning. It's really a pivot from saying that the wisdom exists like in our agency or in our institution already and people just need to follow it, and instead says these teams, these professionals have hard-earned wisdom they need venues and opportunities to share with us. So it's a really kind of important reframe, a very restorative storytelling approach to accountability. It is a place where anyone can ask questions without looking stupid. Anyone can ask for feedback. It does not mean that they're incompetent. We can be critical respectfully without appearing negative, and we can suggest improvements without appearing disruptive. So it's not about kind of this laissez-faire approach to accountability. This is about a high but shared, constructive, and system-focused approach to accountability. And maybe also important is to say that it's not a place where people always feel comfortable, because in psychologically safe environments, we surface a certain level of discomfort or conflict. Psychological safety is about feeling safe, expected, respected, supported, free to take an interpersonal risk, free to disclose a divergent point of view. In essence, it's permission to be candid.
And
there is a path.
Yeah. Sorry, go ahead. I was just going to say, can you share a little bit more about what that sort of looks like?
Yeah, of course. So there is a path, I think, to psychological safety that is maybe important to say. I think it's important, especially for leaders, as they might try to take some tangible kind of next steps, that we all come into our workspaces in like this different place, you know, based on our life and our lens and our prior work experiences. It needs to start from a place of inclusion where people feel valued, treated fairly, they are members. It then starts with asking questions, learning from mistakes. So kind of that willingness to personally change and to be affected, to be vulnerable. And then after that, it's collaborator and then challenger safety. We're engaging respectfully, equal voice, constructive debate, all the way to the point to where we're challenging kind of even those things that we consider normative. You know, if it's not working for us, we feel comfortable in our agency surfacing those things that maybe have been going on for a really long time, but if they've not been working and they're not serving us or our clients best, then the willingness to think differently, try new things. It's about psychological safety that takes us towards a certain set of behaviors that I think we're seeing some early evidence have impact, not only for professionals and their well-being, their retention in the workforce, but also in the care that they provide to families or to clients. So it's about spending time identifying things that could go wrong, talking about mistakes, testing change, deferring to expertise. You know, I don't have to be good at everything, but who do I know that's good at what I'm not good at? Taking really important and central to an agency's work, the acts of appreciation and gratitude, and then as a precondition, not a priority, because priorities can be shifty and priorities can change, but as a precondition, bringing candor and respect into our workplaces. So there's a link at the bottom. It's a really long link, of course, but glad to send to attendees of this webinar today. It's just a PDF of strategies, different kinds of things like huddles, debrief, structured communication, different things that can help you think about how you can operationalize psychological safety towards these team-based strategies and providing safe, you know, mindfully coordinated care to families or to clients broadly.
Yeah, we'll definitely make sure to get all the resources that we mentioned today in the webinar in the chat or in an email to all the attendees after it. So thank you for calling that one out in particular. And Adrian, I think I saw a little bubble that it might be a question in the chat. So this might be a good time to field that.
Oh, sure. Well, people were curious about the name, Amy Edmondson's name. They had just missed that. So that came up a couple times. And then a follow-up question about the slides being distributed after the webinar, which it sounds like, yes, that's a yes.
This is a resource-rich webinar for sure. All right, speaking of more resources, I'm curious, we talk about psychological safety, but I've also heard you talk about safety science. So how is that different, and what is safety culture within that? How does it all relate? What are those different concepts? If you could talk a little bit more and level set that for us.
Sure, yeah, it's maybe jargon heavy, isn't it? Just before I say about safety science to inform a safety culture, which contains, is a foundation, certainly with psychological safety. I think probably a common question is what some early data, like what does early data tell us? Definitely not lost on me that our webinar today is about worker well-being and retaining, a skilled and supported workforce. And so just some early data that we've seen on our team at the University of Kentucky, because we do organizational assessment as a part of our engagement with jurisdictions, with agencies, with sites. We work with a lot of public child welfare agencies, so we tend to think of them as jurisdictions. But we see that as psychological safety increases, that so also does workplace connectedness, and employee turnover decreases. So important to say that psychological safety can have a really profound impact in the way that we provide care to families. Also, it helps us retain and help build connections across our workforce. As psychological safety increases, also mindful organizing increases. So that's what I was talking about, those team-based, behavioral strategies. It's about kind of anticipation and containment, all about supporting families and being safe and thriving together. So mindful organizing increases emotional exhaustion, which is the component of burnout that's been most highly associated in the literature with employee attrition or employee departures. So emotional exhaustion decreases. And then as mindful organizing increases, we also, again, see those relationships to workplace connectedness improving, emotional exhaustion decreasing. This is all early data. These are correlations, but we're excited to see this. And also we see as mindful organizing increases, we have some really incredible partners, Dr. Richard Epstein at Northwestern University, who have been able to connect some of that to child level outcomes about an increase in parent-child visits and a decrease in various types of interruptions, like in congregate care, a night on runaway or in detention or in a psychiatric bed, that those decreases mindful organizing increases. Also placement disruptions, where we might move a child in foster care from one home to another, how that can decrease as mindful organizing increases.
Hi, Dr. Lindsay. We have a question in the Q&A, just unpacking a little bit more about mindful organizing.
Sure, just unpacking it a little bit more.
Yeah, yeah.
Oh, sure. So just literally what's mindful organizing? I've got it. We could do a webinar just on that, actually. So I don't want to take up too much time of today. I also think Chip and Mike are going to speak to it. So they'll be able to operationalize it kind of on the ground, maybe even differently than what I can. But what I will say is mindful organizing has a long tradition in other high-risk industries. In aviation, it's taught as crew resource management. In healthcare, it's taught as team steps. Just these different ways that teams come together to provide coordinated care that's really baked into their habits. So things like huddles, the ways that we all come together, share quickly to organize around a problem or something that's about to happen next, that we really want to make sure that it doesn't go wrong and that the first decision is the best decision. So things like huddles or debriefs, really kind of quick sessions across teams that say what went well, what didn't go well, what are we going to do differently next time? Just these really simple but kind of tried and true practices that exist in other safety critical industries that have, I think, such immediate and promising application in what's often my field of public child welfare, but also broadly in behavioral and mental health, human service space.
Yeah, I think that, we're talking a lot about child welfare today, but I think that a lot of these lessons and concepts can apply across the human services spectrum and beyond into many helping professions. So let's get back into that safety culture, safety science, psychological safety. We understand a little bit more about, all the benefits that we might be able to see if we work towards that goal. So let's talk a little bit more about those terms and what that means.
Sure. So safety science is a multidisciplinary science. Safety culture is the outcome. It's what you're using the sciences of safety, probably also improvement and implementation. You're putting those to work in your agencies to inform a safety culture. And so when we say a safety culture, what we're talking about is an acknowledgement about the high risk nature of our work. Our work matters. It changes the course of families' lives. It's possible to get it wrong, certainly, like to think that we know what's going on, to think that we know what a family needs, and to have our systems misaligned to truly provide help. And if ever there was something that helps the workforce feel committed, connected, engaged, it's feeling effective, safe and effective in their work with those that they serve. So it's the acknowledgement of the high risk nature of our work. That importantly, we really have to promote this blameless environment where people can surface their errors, their problems, mistakes, divergent points of view. So we have to create these cultures where we know where fear can be present, and we're baking psychological safety right into those moments. So we're trying to be really intentional in those moments where fear can be present, where silence can pervade, and we're pivoting to thinking about how we're going to keep people engaged and respectfully honest in those engagements. It's about cross-rank collaboration too, and committing resources. People always ask, a lot of times, and Chip will speak to this for the National Partnership for Child Safety, which is something that Franklin County is a part of and that my teammates and I support. We often talking about having a family-centered, workforce-informed, systems-focused. So it's distinctly 3 important things to learning from serious events, sentinel events, certainly in public child welfare, it's child fatalities and near fatalities where the agency had open or recent contact. And, you know, your culture plays out in these moments where there can be a lot of fear and finger pointing and blame, far more negative attention that can lead to risk-averse case practice and hurt both the workforce and the families they serve in the future. So we support aligned with a safety culture, aligned with building psychological safety, and operationalized in the National Partnership for Child Safety, but also other agencies outside the partnership increasingly turning to this approach too, which we love that. It's been really encouraging, and we're glad to be a part of that work. 3 values that anchor critical incident reviews, where it's not about just departures from policy or expected practice. It's really asking, were families' needs met? We can't assume that following policy and practice actually results in families' needs being met. And the workforce feels psychologically safe to talk to us about the things that they care most about, which is knowing whether or not they were helpful and how they feel like their system was misaligned to provide the help that families needed. So family-centered, workforce-informed, and systems-focused critical incident reviews.
So let's talk a little bit about this tool here, as we're centering on how to kind of start thinking about this.
Yeah, we have a tool that supports, it's a free download. Glad to share it with anyone who would like it. We have a tool that supports a critical incident review process. And if you'll give it one more click, I think. Yes, it has 25 items that start with walking through the child and family's needs, and then think about that child and family as they were served by professionals who operated within teams, and that team, you know, who was situated within an environment, kind of that macro family or human services system. So what we're trying to do is support systems thinking so that systems can innovate and improve their practices as a result of these reviews.
And then before we move on to talking to Chip about the national partnership, I know that there's also a team first field guide. Can you talk a little bit about that resource?
Sure, we're glad to provide that to anyone who's attended this webinar, or just broadly anyone that's interested in it. It's another free download. So it's a curation of resources as mindful organizing's practice in other industries that's been tested in human service settings. So if both those things are true, it's derived and curated from other safety critical industries like healthcare, and then practiced in public child welfare, human service agencies, then that leads us then to inclusion in the Team First Field Guide, which describes for you, you can just kind of pick it up and read through it, see maybe the couple of things that you'd like to try out in your teams or in your agency, things like resilience rounds, or plus minus interesting, which is a supervisory tool, just things you can kind of pick out and try to help build these practices that are grounded in psychological safety in your agency.
Thank you for that. So Chip, I'm going to transition over to you because I know through Tiffany that you've been involved in the National Partnership for Child Safety for a while and that you met her through this group. And I want to talk about what this starts to look like in real life on the local level there in Franklin County. So can you talk a little bit about how you first got involved with the partnership and what that's meant for you all at Franklin County?
Sure. I think I was probably maybe I first went in 2013 to one of the safety culture in Kentucky. I can't remember exactly, but I wanted to step back just a little bit and talk about the Federal Commission to End Child Abuse and Fatalities that occurred in 2016. Dr. Sanders, who's with Casey Families, was involved in that process, and kind of they were looking at fatalities and near fatalities and how they could eliminate those. And through that, they became very informed in safety science, which moved forward. How do we begin to bring jurisdictions together and collect data so that we can learn from that and have an incident review process and really take that data to move it forward. And thankfully, we have the support of the University of Kentucky and others. And it's, as you can see on the slide, I'm not going to cover all these data points because there's a whole bunch, but it's kind of like you take a snowball, those that have done it, and you kind of roll it, 20 times, and you don't make any progress. And then the last 3 times it becomes massive. And that's really what's happened here in the last few years. We're now up to 31 jurisdictions. We went from 21 to 31 just in the last 2 years. We have jurisdictions uploading partnership agreements and uploading data to data warehouse. And we have a communications platform where we're beginning to learn and share talking points across jurisdictions. So a lot of this is kind of grown exponentially. It seems like really just in the last few years, although you can see they really started this work maybe back in 2012. But for really me locally, the idea of creating an environment where staff can feel safe and share their concerns has been significant. We started this work probably in, I don't know, it was pre-pandemic 2018 or something. We started sort of this culture change journey, and we did a safety or the culture survey. And from that, we did a whole lot of debriefings and really began to learn about this work of safety science and many of the things that Tiffany was talking about. How could we begin to put huddles and different things like that in our daily practice to begin to think about how we create this environment?
Yeah, I'm going to pause you really quick because you mentioned the sort of assessment that you did on your own culture. That can be a scary thing as a leader to dive into. But what was that experience like for you with assessing your own agency's culture?
Well, we used the partnerships safety science survey, the one that was up on the screen earlier. And really, we did a lot of level setting with our staff that we had never done this work before. We never asked these kinds of questions. And so really the goal was we wanted them to be as honest as they could, be as transparent, and, share their thoughts and concerns. And candidly, a lot of leaders may not want to do that, but how are we going to move forward and support our workforce if we can't take those steps to move forward? And so I think we had something like 90% complete our survey. We have like maybe 850 staff at that time, which was the most we've ever had in any survey ever. And so, we just started down the journey and down that path.
Yeah. And you mentioned the huddles. Is there anything else that you started implementing after you did those debriefs and took a look at those results from that assessment?
We did put some of the huddles and debriefings and testing change and different pieces in practice like that going forward. And then COVID happened and everybody went home, and it's like, how do we keep this momentum moving forward? I can't remember the number of huddles or debriefings that we had after the safety culture survey. It was over 100 of small group conversations, particularly looking at each individual's division or units outcomes, and then thinking about how do we take that information and put it into practice to move it forward. And then COVID happened, and that's when I went to staff and was like, we need to figure out how to continue this work and move it forward. And so thinking about psychological safety, I think the next slide is where we have our hashtag Saving Grace campaign, which really the staff put into practice ways in which we could help support our staff through that transition. And it was kind of recognizing that we all have our own individual experiences. They're not exactly the same, but how do we give grace to others through this, recognize them for their commitment to serving families, and just kind of took much of this work to begin to carry us forward. And we also heavily worked on our equity work at the same time as we think about how we all had different experiences and it affected us differently as we moved through this work.
Great.
The little hard hat there, is sort of like, it's a safety culture. We want to protect your brain. We're under construction. We're not going to get this right. It's a process that we're working on.
Yeah, but what I like about your story is that it was top down, and it wasn't, again, like I said at the top, placing that onus of caring about well-being of the individual staff within your agency on each of those people, but rather we're all in this together, and as leadership, we're going to really take this seriously. And so that's maybe a good segue I just gave myself for on a statewide level, that's also important to think about. And Ohio, for those who don't know, is a county administered state. So there's 88 counties that all have folks like Chip Spinning who are in leadership positions and moving their own agencies forward. But there's also this partnership with the state as well, and that you have your own initiatives too. So Mike, I'm going to turn to you, but real quick before I do, I see we have some more questions in the chat. So I just want to give Adrian a chance to let me know if there's any we want to tackle right now, or if we're going to wait for the end.
This might be a quick one for Chip about, so the question was, how did they get 90% to complete the survey? What strategies were employed? Was it increased communication and so forth?
Well, I'll tell you, but it's going to not be very helpful for you today, post-COVID. But at the time, we had very limited flexibility in when staff could wear jeans. So every time we hit a higher level of higher participation, I would increase the amount of jeans that they could wear to where they were at, I can't even remember whether it was 30 days or 60 days or 90 days. Now post-COVID, I don't have a tie on and we're far more relaxed. And so I'd have to come up with some more strategies in the future to move that forward next time.
Sounds like essentially there's an incentive-based strategy there. Whatever that incentive means to your agency is probably going to be very different from North Carolina to New York City to LA. So that might be a local decision, but incentives do work sometimes.
Absolutely. And one more question for Chip. Have you been able to quantify the effect on turnover numbers?
I don't think we're there yet. We still have a lot of work to do. And just like everybody else, I'm sure for us, it was in November. We were actually overstaffed from probably 2017 until November of last year. And that's when we really saw the bottom fall out for us. And we're, still sort of struggling for that. But so, more to be learned, more to see how this plays out. And we're looking forward to doing the next generation of the survey here fairly soon. So hopefully we can use that as a buffer to see, are we making progress in some of these areas?
Well, let's talk about that next generation, right? So PCSAO has, and Mike, I'm going to ask you to share with the group what that even means, that acronym. We love acronyms in human services. But they've decided to take this on a statewide level as well. So can you talk a little bit about how these concepts first made their way to you all at PCSO and what your goals are around this project?
For sure. So Public Children's Services Association of Ohio, PCSAO, and we are a member-driven organization. So we represent all 88 counties in Ohio, child welfare systems, and our focus is on public policy, programmatic excellence, and public policy. So long story short, I believe Chip brought it to our executive director, who became a champion of safety culture. But really the context matters for why that why it was championed. So over the last few years, so much change has been happening within child welfare. And for so many of our members, it felt like it was happening to us and not with our voice driving that change. And so PCSAO put safety culture in our strategic plan as part of an effort to modernize ourselves as agencies. And the context that I'm alluding to that I want to be specific about is safety culture is a priority along with race, equity, and inclusion, so that we have a community of practice around. We're developing a shared practice model that creates a practice framework to cultivate as a state, and then the development of a continuum of care. So safety culture is one of 4 priorities for us. But the additional context is that the needs of our kids and families have changed, and we haven't changed how we prepare our workforce to address those needs. We are smack dab in the middle of a workforce crisis. I know that many industries are experiencing it. The reality is that when a child welfare worker leaves, the likelihood of that child, a child on their caseload exiting foster care plummets. And so we're talking about, as Tiffany mentioned earlier, very real impact on kids and families. Turnover is not just turnover. It's longer length of stay, it's more disruption, it's more trauma. Our field is changing as well in terms of what is expected of child welfare workers. And so when you tie that back to the motivation for safety culture, with a new generation of workforce coming in, not knowing who to turn to for what level of complexity of expertise, who are the subject matter experts within my organization that I turn to? When do I turn outward? Is turning outward outside of our org okay? Those are cultural norms that aren't always clear. And when they're not clear, they default to not acting. Many of our team members are not well. I mean, I think I might have seen a comment in the questions about vicarious trauma. Trauma triggers trauma, and we've all been experiencing it through the pandemic, and as well through the heightened needs of our families and children. I don't think we talk about this enough, that when kids with really complex needs come in and our workforce is unable to meet them, that in and of itself is a professional trauma. Seeing a need for a helper and having no idea how to help is traumatizing in and of itself. And then I think I've probably made the 5th point already. This is way too important for us not to change the way we work.
Yeah, ultimately, I think all of you have spoken a little bit about, I think those of us who've been in the field can attest to, like, I feel most satisfaction in my work when I feel like I've made impact. And knowing that turnover creates negative outcomes, that can really ground us in why we should tackle that problem beyond just the operational difficulties of having staff turnover. So PCSAO decided to take on sort of a project in Ohio. And I know that you're early in that project, but I'm curious if you can share with the group sort of what that looks like for you all.
Yeah, so we're big believers in implementation science. So we spent a lot of time upfront building awareness and readiness about what even safety culture is and why it would be important. And as we moved into the exploration phase, we identified 15 counties, PCSAs, who made a commitment to a 1-year effort to test. So this is very early exploration and implementation, just as a state trying to look like, how do we scale, or trying to explore rather, how do we scale this work, but then also continue to work at a local level. So as you can see from this map, pretty well spread out, pretty well balanced as well between small counties, medium and large. And so we are, smack dab in the middle of the year and actively testing change.
And what's been your plan? What's your approach? If I'm a different state thinking about wanting to do this, how did you get started, and what does that plan look like?
So, like I said, I mean, we were very transparent with our members in saying we're looking for counties to come alongside and explore with us what is an individual county solution at the local level, and then what can be scaled and built out to offer as change processes for other counties across the state. So essentially, Chip mentioned it, Tiffany mentioned it, we used the safety culture survey. So we are working with the University of Kentucky to administer that survey, and then provided comprehensive data reports to our members. I will say, as difficult as it is in the field right now, and as challenging as each day is, our members were overwhelmingly surprised at how good some of the numbers were in some of the safety culture scale areas. Like, we're not doing as bad as we thought. Feels a little relieving. So we conducted that survey and provided the results in May and June, processed them together. And where we are right now, to answer your question as directly as possible, is we're helping each one of those 15 PCSAs develop their own change plan. What does this look like in terms of, are we writing new cultural norms? Are we providing new benefits to employees? Where are the areas that we determine are strengths we want to build on or weaknesses that we want to address?
Great.
And this is just an example. This graphic actually comes from a member of Chip's team, but it's got good colors, so I thought I'd use it. But these are the 8 safety culture scales, and just wanted those watching to be able to wrap their brain around when we say which areas. So, you know, psychological safety was talked quite a bit about early on, but it's one of many of the scale areas that are interconnected with one another. And so it's been really helpful to sit down with each county. One other thing I want to mention, because you talked about top down. And so one of the commitments from the learning community members was you had to have senior level leadership commitment, but then also we asked them to form teams that represented all the levels. So having frontline workers in the room with senior leadership, talking about what this culture change will look like. But it's been great to sit down and really unpack, how does mindful organizing impact emotional exhaustion? Which aspects are you doing well? And to go back to Tiffany's point earlier about some of the mindful organizing that exists, I often think about red team or group screening, you know, agencies that get together to make really difficult decisions. I think as a field, we do some of these things. It's how do we scale them and use them in different settings?
Yeah. I think I keep hearing teaming. I think that's a really tangible piece to pull out of this. How can we incorporate team decisions throughout all the decision-making points that happen in child welfare and all human services? So I'm going to ask the negative question first, and then we're going to get back to being strengths-based. But this all sounds great. Wonderful. I'll do this assessment. I'll learn from these resources. I'll implement these things, and everyone's going to be great, and we're all going to be much more psychologically safe. That, again, sounds great on paper, but what are some of the barriers that you have experienced, either Chip on the local level, Mike on the state level, or Tiffany, when you've been working with jurisdictions who are implementing some of these concepts, that you can share to others as sort of lessons learned? And Chip, I'm going to start with you. So what are some of the barriers you've experienced? I think we've touched on a couple, but if you could share more.
Yeah, I think it's, you know, you have to talk the talk, right? So we're going to create a psychologically safe environment. We're going to be transparent. And so as leaders, like you asked me the question, why you do the survey? How am I going to create an environment if I'm not willing to take the risk as the leader? You know, another example would be in our new staff orientations, you know, all the leadership team is there for that. And, you know, we'll share where we made mistakes, and you're trying to create that environment, even with new workers. And even myself, I'll share where I made a mistake or whatever, and the importance of learning from it, moving forward, and that kind of stuff. But you have to, I would say, be on guard all the time to be as transparent as you can, slow down, be co-creating, bring your staff in. And, you know, it takes a lot of time to do it right.
Sure. So I mean, you're expending a lot of new parts of your brain and emotional effort in new ways. I can imagine that can sometimes, as a leader, be a little tiring as well. So hopefully your organization is taking care of you too, Chip. But Mike, how about you with your project so far in Ohio? What's been difficult in getting started and working with these 15 counties so far?
So I'll hit you with 3 really quick barriers
Boom.
that come to mind. One is, so like a term like workplace connectedness, which is a really long term for how well do you feel connected or supported by your soup. But what support feels like, Tiffany mentioned it earlier, is different for each person. So the way I think of it is, one person's team building is another person's nightmare. right? So a supervisor decides to take their unit out for an activity, and it gives half of them anxiety and half of them feel so heard and seen. The second is that there is both implicit and explicit culture. Culture is a tricky beast, and it's got to be defined and owned and nurtured. So explicit culture is we do huddles and debriefs. Implicit culture is the eye roll that the people leaving the huddle do because they don't like those people over there. They don't like what was talked about. Controlling the eye roll, creating an environment where eye rolls aren't acceptable, that's tricky. That's a barrier, right? And then the third, as a facilitator of a multi-county change process where we're learning at the same time, it takes a lot of vulnerability to ask questions and unpack areas when you may not have the solutions yet. And I think that goes to what Chip was saying about being super intentional.
And Tiffany, could you share, I mean, you've been doing this a while. What are some barriers that you commonly see?
Yeah, I echo everything that Chip and Mike said. They're right. I think that what I see on the national scale is, and certainly what my colleagues see too, is that when you have a really bought in leader, I mean, they are invested, just like Chip, just like Mike. They eat, sleep, breathe this stuff. They're thinking about it all the time. They're really invested. And then a couple of years down the road, it's somebody new. It's a new leader. Hopefully not a couple of years for these two guys, but that it becomes somebody else. And so this is a very top-down effort. Takes top-down intentionality. That's not to say that every single one of us can't make an impact in our really local environment, but the greatest impact comes from our leaders being really invested in what this means and really committed to operationalizing the details. And it's hard, and it's certainly hard. There was a question in the Q&A about that too, about what do you do when your leadership changes every few years? Community helps. So, the National Partnership for Child Safety benefits from a peer-to-peer community and shared accountability, kind of the collective conscience of that group. They data share, which is also excellent. It took 3 years to get to that point where, they were really ready to start sharing vulnerably, not just anecdotally, but, with detailed data with one another. So we're just now getting to that place, but excited for the promise and the innovation that I think will come from it.
Yeah, top down has been said a few times throughout this. And I also really like the point around having the right people in the room. And we think about this a lot with organizational change in general, that you have to have decision makers obviously in the room, but also the people who really know what it's like. So those different levels coming together can sometimes be a little spicy, but I think it's critical for any kind of change, including this type. So let's talk about what's gone well in Ohio as you have embarked on these journeys on the local and the state level. And Mike, I'm actually going to go back to you first, since your project is a little newer in the stages. What have you seen so far that is fueling you to keep going?
A couple of things come to mind. One, it's been a great opportunity for some smaller counties who get left behind by a lot of initiatives and programs and services. So really small counties who see this as a change they can make and be a part of a larger cohort. The second, I would say it's an excuse to have conversations that have otherwise just gone unattended to and festered. Conversations at the individual level. We have leadership teams coming together and saying, you know what, I think today is the day that we start to tackle this problem, this cultural problem that has prevented us from feeling safe to address some of our own challenges. Those are two that come to mind.
Sure. How about you, Chip? What's gone well so far?
I think it's given us a good framework to look at as we are moving forward on a regular basis. So as we continue to raise these concerns as an organization, it gives us the opportunity to hopefully remove silos. We put into place an organizational health department to really look a division that looks specifically at our workforce and how now we're in the new stages of it. But I can't imagine we would have ever even thought about this 3-4 years ago, to where we can now, have somebody, for example, I was saying the other day that every single day in our organization, there's a data point that is a reason to recognize staff, a good data point. You know, a child reunified, somebody was a year out from returning home and they're still home, you know, an adoption has occurred. How can't we look at our data and then create a way to recognize the work that's been done by staff that were connected to that case that's long past their mind, you know, but they're sitting in a situation that they're just managing their current caseload. And, you know, I think having a division to think about how to recognize staff, provide these learning experiences, enrichment, and that kind of stuff, we would have never done that before.
Sure. Yeah, it's interesting. Safety culture talks a lot about how important it is to think about how we behave when bad things happen. But you're sharing it's equally important to look at how we behave when good things happen. And how do we celebrate that in a meaningful way that resonates with the people who did that work. So thank you for that example. And Tiffany, if we could, again, think about this, what you've seen before in the jurisdictions you work with across the country, what are some, you shared a couple of the outcomes around like mindful organizing and some of the benefits we see there. But what have you seen as big strengths to this work and outcomes?
Yeah, I think, yeah, we're starting to see kind of some of the demonstration and spread, and that's really exciting. When my teammates and I have gotten connected to this work, we almost always have the benefit of doing it within larger communities. So several state, county, tribal entities coming together at once to learn and engage in this work, or several congregate care providers being offered an opportunity through their state licensing to think about this work and how it might relate to the way that they, with safety and quality, serve youth. So I think the community aspect has really been, it holds a lot of potential. I think it leads to more spread and innovation, more success. I think just like a couple kind of really quick things. I have just recently, I've seen where there's some system innovation going on and really understanding how in public child welfare, we end up being very mother-centric in our work and not engaging fathers. And instead of what I feel like becomes a really typical conversation of, well, we just need to do more tracking and we just need to write more policies. It's really thinking, how do we remove system barriers and place resources and support right in front of caseworkers' faces, like, right, you know, drop it down right in front of professionals when they need it most to help them engage fathers meaningfully and early in casework practice. So just a different perspective that leads, I think, to so much better outcomes for families, because no longer are we thinking about like the rigid adherence and control. We're thinking about the system alignment and support, removing barriers. So that same thing with safe sleep, where it's not only providing the education to families, like we're placing babies alone on their back in a crib in a non-smoking environment, right? So for those of you familiar with fatality prevention, it's the ABCDs of safe sleep. To think more broadly about how do we give access to really concrete support to families who are caring for babies, and really addressing their concerns, their worries in culturally responsive ways. So it's only through really having that psychologically safe dialogue and engaging in that system thinking with professionals that we can innovate in those ways. It's really meaningful for the workforce.
And I'm going off script a little bit, but have you seen, there's a question earlier around, have we seen this move the needle on retention? Do you have any thoughts around that?
I hope that we get there to that place. Most of what we have now is early data. We see the correlations. So it's not the change over time. What we see locally is that the presence of things like emotional exhaustion and psychological safety can vary greatly across teams. And as psychological safety increases, we see that emotional exhaustion also decreases. We see that turnover decreases, but it's point in time measurement, the ability to really look at it longitudinally. I think we're just now getting there. So that'll be exciting for us in the future.
Definitely. I'll
Can
be
I
watching. Go ahead,
Can I
Mike.
just jump in and throw one comment to that? I mean, it's heartbreaking. It's not the most uplifting comment, but a lot of times when we were processing the survey results, the feedback from staff to their leadership was a lot of the people that filled that aren't even here anymore. And that was 2-3 months ago. And that's hard to realize that that's the norm of what we're experiencing right now. So I think just like stabilizing is step one, really trying to then impact retention is the next phase.
Yeah, that's fair. So let's talk about next steps. Okay, I'm listening to this webinar. I'm in. I want to do it in a minute or less, so we can get to a couple of questions. Tiffany, what would you say is what folks can do to start working towards this?
I think like the thing you can go do today is start asking in meetings, can I hear another point of view? So just start creating psychological safety by asking for a different point of view. Also be vulnerable yourself with a mistake or a time when you just didn't see something, you see it differently now. Be clear about that. When you vocalize, you give the same opportunity, you model it for others to do it also. Organizational assessment is important, and also looking at how you learn and grow from bad outcomes is equally as important as longer term goals.
And more on those tangible strategies in that Team First field guide, if I'm understanding that resource correctly.
Yes. So glad to share that.
We'll share a lot. So Adrian, I'm gonna see if there's any questions. I think there's maybe a few, but I can't see them from my view. So I'll lean on you for that.
Yeah, one question that came up in the chat that a couple people have thumbs up is, I'm curious about what consideration you gave to white dominant culture as you worked to elicit input from staff as well as create psychological safety. And also if you can share any specific examples of how you incorporated race equity into these considerations and strategies.
Thank you for that question.
Yeah.
Anyone want to jump on that right away? Tiffany, go ahead. Or Chip.
Chip, did you want to say something?
No, go ahead.
I think it's really important that you give people the opportunity in these surveys to identify themselves, to identify their race, ethnicity, sexual orientation, gender identity, that you give people the ability to describe, so that then as you look back through your responses, you can organize them by differences in employees' race or sexual orientation or gender identity, so that you can look at how those results may be similar or different, how responses are similar or different in your agency. We also, it's under pilot, but I'm glad to send it. It's really in development. We have a racial justice scale that we've started using as a part of the safety culture survey. And so I'll include it in what I send out.
Did you want to weigh in on that one as well as what that looked like for you guys?
I was going to say, yeah, we were really interested in adding that piece to our next survey when we do that work, to take a look at that.
And the only thing I would add is that we have several members, if you think back to that map, who are both a part of the REI community of practice, as well as safety culture, because at the root, what we're trying to create is an environment where showing up as your whole self and being able to have safe conversations about the impact that the system you work in has on families, that how it affects you and the role you're playing, are conversations that need to be had as part of the reconciliation as well as planning forward process.
And I was just going to add, if there's time, that, parallel process, we're asking our families, can you just be honest with us? Can you, right? Do we create a psychological space for them to be honest with us? And if our staff aren't feeling it, our families aren't feeling it. And we're not getting to the root of the cause, right? And so we have to start with sort of in our own house first to move this work forward, I think.
And I imagine it's important as you go through, your debriefs and whatnot, to ensure that you have representation across your agency, not just the levels of employee, but who can bring that perspective of what psychologically safe means to not just white dominant culture, to ensure you're incorporating that into your plans as you move forward. Any last questions? I know we're at the top of the hour, so Adrian, I'll leave that decision to you.
Well, just quickly, Chip and Mike could also jump in, but when soliciting staff input, did you uncover anything that shocked or upset you regarding the well-being of your staff?
I don't think it shocked me. And it's sort of why we framed in the beginning that, we're just setting a baseline. I think we found that often staff, didn't feel as though they could be as candid as they want. They didn't feel as though they could talk about mistakes. They didn't feel as though they were always supported. And I think if we talk to our staff regularly, it's not a surprise. We're very hierarchical organizations. We have to figure out how to break down those silos and create, a better environment and a better culture where folks can be them whole selves. So
What Chip said.
Well, great. And I'm sure we might have a couple other questions, but I want to be respectful of everyone's time who have taken to join us here. And just thank you so much for everyone listening in. We will promise to get those resources out, likely through email from APHSA themselves. So look out for that, because there is a lot out there. And Google, in the meantime, will be your friend too. If you're listening to this and you're like, I want to start right now at 3 Central. So thank you, everyone. And thank you so much to our panel for sharing your experiences and your wisdom. I think it's really helpful, and I'm just really excited for us all across the country to ground ourselves in the stuff that matters most. So thank you for sharing. Bye-bye. Thanks, everyone.